Namaskar. Welcome to all of you to this eGlobal platform. Myself, Akansha Dikshit, dietitian and a holistic nutrition coach. And today I am going to introduce you one more our expert, dietitian Padma Kathi, clinical nutritionist, as well as a holistic nutrition coach. She is a diabetic educator, certified yoga instructor, and meditation teacher also. So nowadays we all know that PCOS is a major problem growing all over the world. And today our discussion topic is can get pregnant with PCOS naturally. So not wasting much of our time, we are going to the expert. So ma'am, my first question to you is how PCOS doesn't mean infertility. Please throw some light on it.
Thank you, Akanksha. And nowadays, PCOS and pregnancy are perhaps one of the most discussed topics among the women who are trying to get pregnant. Okay, with almost 33% of all fertility issues, polycystic ovarian syndrome means PCOS is the most widely recognized ovulatory problem in women who are facing this issue, means in the reproductive age. And you must have came across many women among your friends or neighbors or even with family members also having the PCOS. PCOS means this is a common endocrine system disorder among women of reproductive age. Can't get pregnant, and a woman with PCOS disorder feels that she has acquired the most dangerous disease and that she will never be able to conceive after that. Because of that, their irregular periods or maybe continuously their weight gain or maybe inflate one day. And PCOS means this is a common endocrine system disorder among women of reproductive age. And nowadays, you see infertility rises, millions of women who are suffering from this issue. And most are asking, can I get pregnant with PCOS? This is a common question that may rise nowadays, and who wants to plan their pregnancy in young couples. And in this issue, what will happen in PCOS may have enlarged ovaries that contain small collection of fluid and follicles located in each ovaries as seen during an ultrasound scan exam. These are the main issues. That's why they are asking this question.
Yes.
Means lifestyle modification, definitely they can conceive with PCOS.
Okay. So like, yes. So means, okay, so many things are related to the PCOS problem, means enlarged ovaries and whatever amount of fluid is there, all that things. So can you tell me about the signs and symptoms of PCOS and how it is related to the infertility?
Yes, in infertility, signs and symptoms are very different to one woman to another woman. Some are facing one issue, and some maybe are facing 3 to 4 issues, and some are have cyst, or maybe some persons are not have the cyst also. Vary because this is under negative thoughts and stress which further only worsen their condition. But in generally we can see now in generally what will they have irregular or no menses leads to weight gain or maybe acne and oil skin, and mainly many PCOS women are facing this hirsutism, facial hair growth, and otherwise abnormal hair growth. If you observed, many are facing hair means abnormal hair growth on chin or maybe chest, and different means obesity also one of the reason, means increased insulin resistance and hormonal imbalance and skin discoloration. All these are the common symptoms of PCOS.
Okay. So means our whole body functions and whatever thoughts we are having, all other things are related to our conceive thing. Means
Yes.
with PCOS that conceive is good or not, means how we can conceive that. So why it is difficult to conceive with the PCOS? Means any specific reason for that?
Yes, in my practice also, many are asking, this is a frequently asked question, who are suffering with this issue, because in PCOS leads to hormonal imbalance, right? In that woman, what reflect means their overall physiology also reflected, means they need to a healthy egg and right timing and a perfect hormonal atmosphere to fertilize the egg and implantation also. So ovulation issues are normally the essential driver of infertility in women with PCOS. Means ovulation may not happen because of hormonal imbalance or maybe anovulation or maybe irregular periods, delayed periods, or maybe result in the high secretion of testosterone because of their hormonal issues, and all these are affect to the ovarian cyst also. All these are affecting. That's why their hormonal imbalance and their ovulation period also sporadic, means they can't get a proper time, one proper time. In this case, they can difficult to ovulate in certain time.
Okay. So my next question is related to implantation only. Means with PCOS, high implantation failures is true or it is a false thing?
Yes, when we are seeing to research studies, new research studies, it's true. Because of the problem with the hormonal imbalance, but in hormonal imbalance also, their problem with endometrial preparation or the endometrial receptivity or the entire hormonal atmosphere around the fertilized egg. So these are in hormonal imbalance, so it's true.
Okay. So means whatever hormonal changes are going on, that is also very important for conceiving
Yes.
and for the implantation also.
Yes.
Okay. So if someone is having a irregular cycles, then how we can calculate our ovulation period?
Yes, Akanksha, this is the trickiest question you are asking, means who are specially facing issues with the PCOS. See here, one is some are like their fertile period is difficult to some people, but who are the regular cycles, like maybe they have 28 days, 32 days, or 50 days, or maybe even 90 days also, but their period is regular. That people, that woman can count 14 days before the expected period, that is their fertile day. If any women are facing irregular cycles, means first month is 1 month and second month is maybe 3 months, that women can observe their natural physiology of the body, natural changes for their ovulation in their body. They can observe the cervical mucus in that is a very thin and stretchable. If they can stretch, they can see that before the ovulation period, and maybe they can have the little pain in their lower abdomen, right? And if they can notice, they can observe keenly, they can observe the slightly tenderness in their breast and slightly increased temperature. These are the signs and indication of their ovulatory period.
Okay. So means so many symptoms are there, but basic symptoms are very much important so that a woman will be able to know that if she is having a body temperature higher side or even not feeling means breasts are also tender, then that means there is a ovulation time. So
Yes.
okay, audience also, if you have any questions, you can ask us. You can comment on the comment box also. Yes. So, ma'am, my next question is to you is means what is the best age to conceive? Is there any particular age for that?
See here, Akanksha, PCOS or no PCOS, the doctor advises that if you want chances of easy pregnancy, easy conception, and smooth pregnancy for who wants to have a plan a baby. So what happened when age goes up, the number of eggs and the quality of eggs and implantation may impact, and medical complications also, like maybe diabetes or maybe thyroid may be increased in pregnancy. So plan pregnancy as much as early. That is the very good indication.
Okay. Early means as we know that means after the age of the 30, everyone used to say that we should be little conscious about our means future and we have to conceive. So is it true? Means is it related to this problem? Other means if they are not getting pregnant in 30 age, then it will be issues for the women?
See here, according to means new researchers, or maybe if they are not having PCOS issue, that is this question is different to different women. If they
Okay.
are facing the PCOS issues, so they can plan as much as early. That is
Oh,
easy and smooth conception.
okay. So, is that so? If means someone is having a problem of PCOS, then miscarriages is also on higher side during the pregnancy?
Yes, new research, according to new research study shows that 3 times more if they can have facing the PCOS issues because of the high LH levels, maybe high testosterone levels, abnormal insulin resistance, obesity, pre-diabetes, and endometrial dysfunction.
Okay, okay. So now coming to the means next part, that is lifestyle changes, as you told means in a starting only, that thoughts also matters and our life also matters. So how
Yes.
lifestyle changes is very much important to manage the PCOS.
Yes, in lifestyle management is works wonders in PCOS. We have many lifestyle modifications like in maintain their optimum body weight. If they are having above BMI, overweight or obesity, if they can reduce the 5% of body weight also, they can sensitize their insulin. Maybe means PCOS, one of the reason is insulin resistant also. So if they can reduce the body weight, that will be stabilizing their hormonal levels. And one more, second one is the regular exercise. Means when they can do the weight reduction through a healthy balanced diet, and regular exercise can improve their ovulatory function. And in exercise, they also sensitize and stimulate the insulin production to better uptake of the glucose. And they will be release the endorphins, good feel good hormones, and reduce the cortisol levels, which are the stress hormones.
Okay, okay.
And third one is the nutrition important. This is a very much important. Means nutrition means wholesome, clean, and nutritious homemade, which are available local and seasonal fresh fruits and vegetables. All these are helps in reduce they are good content. They can have the rich in fiber and rich in antioxidants, so they can reduce the inflammation in their body. And another one is with lifestyle modification, good quality and adequate sleep. This is also very much important. If they can having proper good quality of stress sleep, so they can automatically reduce the stress. Okay, and stress is also one of the reason is lack of sleep. Okay, this is also very much important. And another, you are asking foods na, so and one more important is they can avoid the excess intake of aerated drinks and processed foods because they contain the HFCS, means high fructose corn syrup, mostly hidden sugars, so which does not get metabolized and is stored in the form of fats in the belly area.
Okay.
Right. So
Okay.
these are the basic lifestyle modifications which they can need it.
Mm-hmm. So yeah, means this is very much important for all of us to know that optimum body weight, our exercise part, our nutrition part, plus good sleep also is very much
Yes.
important to get rid of this PCOS problem or to conceive also. So
Yes.
means as you told, this question was raising to me like is there any special food for uh, the women's who wants to conceive, means as you told that we have to avoid the high fructose syrups and drinks, so is that same like that or it is different?
See here, according to means nutrition myths and fact also, there is a no standard diet to manage the PCOS, but some functional foods are helpful to stabilize the insulin levels. And if they can have the means making good choices under the expert guidance can help you to plan pregnancy with PCOS. Nutrition is important, but not only one thing will help.
Yeah, correct. Very much true. So, my last question is to you is what are the alternate therapies which help the women to conceive with the PCOS problem?
Yes, this is a very much important question. With lifestyle modification, means lifestyle changes should do all the wonders. We have so many alternate therapies to means helps in conceive with PCOS. And here we are doing the holistic approach. Means we are finding the root cause and treat the person also. And already we discussed with a good exercise regimen daily and a regular and controlled meal pattern and a stress-free life can reverse this condition. Along with we can do some it is very important to keep their stress under control and ways to reduce stress levels and good quality of sleep, and in practice their pranayama means deep breathing exercise, meditation, and indulge in their habits means sports or painting or anything they can practice. All these are what they're helpful in their control their thought process and give the calmness and peaceful their mind. And important thing is self-love. Who wants to suffering with PCOS or not, they can start with the self-love practices with under expert guidance. And important thing is take some time out of their schedule to spend their near and dear ones. This is also help to reduce the stress. And with an active body, peaceful mind and healthy food habits can also reverse most lifestyle related disorders. And what I want to say here is that the solution and the power to change is lie within there only. And you just have to take a step ahead and choose what is best for you. This is the mantra for who want to conceive with PCOS.
Okay, that's so nice. Means our stress level, our self-love, and all other things are also related to get conceived or to get rid of the PCOS problem also. So
Yes.
thank you so much, Padma ma'am. This is a very wonderful and insightful session. And audience, if you want to know more about this, you can visit our website of eGlobalDoctors, and even you can get a free consultation also available in the eGlobal site. And stay tuned with us. So if you have any queries, you can get back to us or you can comment on a comment box also. Thank you.
Thank you, Akanksha. Thank you for the global platform for giving this opportunity. Thank you so much. Have a good day.
Thank you. Have a good day for everyone.